And I would like to introduce our first speaker, Dr. Azizur Molla. And before I focus the screen on Dr. Azizur Molla, I would like to say a few words, if you allow me.
Sure.
Dr. Molla is a professor of public health in the Master of Public Health program of School of Interdisciplinary Health, College of Health Professionals at Grand Valley State University. His area of interest includes environmental health, social and behavioral health, and community health. Dr. Molla has over 20 years of experience in teaching and research with topics including E. coli, drinking water, disease and culture, environmental health, health policy, community health, and social determinants of health. He earned his bachelor's degree from the University of Dhaka in Bangladesh, his MPH from University of North Carolina, Chapel Hill, and his PhD from Pennsylvania State University. Dr. Molla has worked with the U.S. Agency for International Development in designing, implementing, and assessing reproductive and public health programs in South Asia. Azizur Molla also coordinated and provided training on global health, reproductive health, and healthcare systems in the health offices in Bangladesh and in Indonesia. He authored a book on drinking water and disease and authored and co-authored numerous book chapters and articles based on his research in the United States, in Ghana, Haiti, Bangladesh, and really around the world. We are so thrilled to welcome Dr. Molla.
We'll be talking on climate change and global health, the diverse drivers for disproportionate social justice fallout. It is an honor for me to talk on this topic. And as Lena, my colleague, is introducing me, I'm Azizur Molla, professor in public health. The way I'll be proceeding is talking about climate change, and you all know that climate change is very much interconnected with health. So initially, I'll be focusing on climate change, bringing up health issues, justice issues. Then I'll be focusing on public health and bringing up climate change and also justice issues. And bringing up finally that how these two drivers are really connected with social justice. If we think about what is really climate, United Nations defines climate as the long-term shifts in temperature and weather pattern. These shifts may be natural, such as through variations in the solar system or solar cycle. Interestingly, since in the 1800s, human activities, many people call that anthropogenic factors, have been the main driver of climate change, primarily due to the burning fossil fuels, the coal, oil, and gas. So these are facts about climate. What are the factors really contributing to climate change? Whenever we think about climate change and visualize it, we come out certain image like this one, as you can see on this slide. The greenhouse effect, some solar radiation is reflected by Earth and the atmosphere. Some of the infrared radiation is going away, some is staying, and it is really warming up our Earth. And that high temperature is causing the problem. That is, we are going to talk more about today. There's some good news, there's some bad news happening. The one part of the United Nations Declaration for Cleaner Air, this I consider is a good news, that access to a healthy environment and universal human right. That itself is a big achievement, no doubt about that. But if you see at the top of the list of environmental campaigners, air pollution, which is responsible for nearly 10% of total deaths, that is not a good news. And this resolution definitely will empower people to claim their rights to a healthy environment and also the rights to breathe clean air and it's an integral component of the right to a healthy environment, as the legal officer of United Nations Environment Program stated. Whenever we look at how we are doing as a planet, we see the Earth is warming up. And if we tell the statistics from 1880 to all the way 2020, we see that there's a continuous increase of it. So the high temperature is not a good news. It hampers not only health, many other factors. And I'll be showing you in an animation that how really our global village is getting warmer since 1880. And here in this animation, the dark blue shows areas cooler than average, while the red that will be showing eventually, that area is warmer than average. So on the top of the animation, globe chart, you'll be seeing that which year, what is the level of temperature. Let's take a look. As I said, on the top, that is showing the year, and the globe itself is showing the temperature level. The more we are coming to our current time, the globe is getting warmer and warmer. So as you see that is what is happening. And I'll be showing what does that mean. There's a very interesting findings found by several researchers. That's a collaborative researcher under the umbrella of World Weather Attributions. It is published in October 5 this year. What we are finding in here is that high temperature exacerbated the climate change, made 2022 Northern Hemisphere droughts more likely. Heat and low rainfall in West Central Europe had far-reaching impacts on a variety of sectors, including human health, energy, agriculture, water issues, and the water shortage, extensive fires, food scarcity, everything. And more death will be happening due to that high level of temperature and the hotter temperature. If we think about whole world, what is happening in the sea, in the ocean area, and also the land area. Some of the example I would like to see you. See in here in the sea area, the August 2022 Arctic sea ice extended was 16.8% below the 1981 to 2010 average, which is the 13th smallest August sea ice extend one record, which is not a good news. If you think what is happening on the land, in North America had its warmest August and second warmest June-August period. In the US, it is the 8th warmest August and is third warmest summer in the last 128 years. Brazil is in South American country, more than 33,000 fires were detected by satellite this August. So there's a consequences we are seeing already of this high level of temperature. Europe has warmest August and meteorological summer. And Africa is also warmer than average month. Asia is the warmest August and second warmest June-August period of time. And if you're following the news in Pakistan, there's about 1/3 of Pakistan is underwater in August due to the record-breaking rainfall from an unusually strong monsoon season that claimed at least 1,200 lives and displaced 33 million people since June. See around the world what is happening. So like that is the impact of climate change. If we take a look further, year-to-date temperature, only in January to August this year, this is what we are seeing on this line. The January-August total surface temperature was 0.86 degrees Celsius, which is 1.5 degree Fahrenheit, above the 1901 to 2000 average of 14.0 degrees Celsius, 57.3 degrees Fahrenheit, which is the sixth highest January-August temperature in last 143-year record. These are facts, evidence, and we need to take climate change seriously at all levels, from policy, law, program implementation, and also our individual responsibility. Whenever I think personally that, we sometimes conceptualize things, some concepts. So if we do some play with concept mapping, try to understand what is climate change, how it is different from weather. Is it really a hoax? That is said by many people. And is it really real? What is the impact of it? If we can keep on running like this kind of concept mapping. And I found that climate justice is not that much of on this kind of a list. And it is not our planner point of view. It is not program implementation point of view, which is an important factor that we must include. Otherwise, we'll be facing catastrophic future for us and for our next generation. I came across a good article on climate change, human rights, and social justice by Levy and Pearce. One of their statement was, these environmental and health consequences threaten civil and political rights, and economic, social, and cultural rights, including rights to life, access to safe food and water, health security, shelter, and culture. Very rightly stated by these two authors. They also stated on a national or local level, those people who are most vulnerable to the adverse environmental and health consequences of climate change include poor people, members of minority group, women, children, older people, people with chronic diseases and disabilities, those residing in areas with high prevalence of climate-related diseases, and workers exposed to extreme heat or increased weather variability. On a global level, there is a much inequity with low-income countries which produce the least greenhouse gases being more adversely affected by climate change than the high-income countries, which produces substantially higher amount of greenhouse gases, yet are less immediately affected country. So what we are seeing, the countries which are producing more problem, they are not the main victim. The victim is someone else who doesn't have resources and technical know-how to face their challenges. So whenever subject like climate change, we need an uniform platform. It's a global platform. Other than that, it will be very difficult to address issues like climate change and save ourselves from its harmful effect on health, on many other areas. The NOAA has really shared a very good image that tells that how the ice has been melted, how fires, the natural disaster, and heat is keep on rising. And ultimately, it is really impacting our neighborhood, our living. So if we do not want to see that kind of a unexpected event, we got to really work on climate change in a collaborative fashion. Intergovernment agencies should work on it. And we all should think that it's not setting a goal rather than how that goals can be transmitted into our individual actions. That is more important. Let's move to global health part. Global health by term itself is telling, it's any health situation beyond your boundary. It may be a researcher, it may be some professors involved in it, some program planner, community worker involved in it. But whenever we see the global health is happening across the globe. Is it come in a single entity? No, it has a very good history. And if we think in brief, sorry, you may not see it, but I try to maximize the font of this. If you think the very first coordinated organized efforts in 1892 and 1893, at that time, the International Convention on Cholera Control, that happened. Next organized effort we see in sanitary control of the Mecca pilgrimage. Then we see plague 1897. Whenever there's a huge pandemic of health problems happening, then the global leaders that time, it draws their attention that something needs to be done globally to take care of our health. Following that, we see in 1902, the Pan-American Sanitary Bureau was happening, then International Sanitary Convention of Paris, that was created in 1903. Then we see that global or international health get a base from the delegates of 12 European countries, and they created Office of International De-Hygiene Public in Paris. Before the World Health Organization was created, Rockefeller Foundation, as a US-based philanthropic organization, did a fantastic job to really expand health efforts globally. And with their effort, I should say that's contributed a lot in formulation of WHO, which we see after the World War II. Now, whenever we put a binocular on global health, what do you find? Definitely global health builds an international health interest and bring up many resource institutions together. But whenever ISIS functions, it seems that it divorced from the health needs of low and middle income countries. That was not the theme. That was not the objective of global health. Global health was created so that in regards of the resources or limitations, every nation in the earth can be benefited. That we didn't see. And then if we take a look, what happened during the COVID-19 era? COVID-19, in fact, became a testimony of global health, because at that time, it's clear that nations who don't have resources, they couldn't get many services like vaccine. If you take a look in here, what we see in US, 81.5% of people are vaccinated. This is according to the Johns Hopkins data. If you see country like in here, in Namibia, 23%. If you see in here, Kenya, 25% people has vaccinated. So if you go across the world, we don't see that fair distribution of such an important vaccine, which means we couldn't really ensure the main purpose of global health. So I wanted to show you that we understand that how really global health is hampering by many factors that we. Paul Farmer, I consider him, as I'm a big fan of him. We lost this great person recently. He told that global health has been mostly dealing with communicable diseases, smallpox to AIDS. He was talking because he was a big promoter to take the surgery services close to the people. So that was the main reason. In fact, COVID has shown us that global health is not really being benefited. Every nation is being benefited by it. So that is another part we can see. But World Health Organization still is a leading force to ensure global health. It lacks some resources and technical know-how, but at least we have some institution that is providing global health. In addition of WHO, many countries like USAID and many international health agencies based in US, UK, European countries, even Turkey has recently started very good. Canada has started a very good global health efforts. So all those parts we are seeing. That's great. And that is a good motivation to ensure health. But whenever we see climate change, when climate change is impacting on human health, then there's a double coordination and collaborative effort is needed. Otherwise, we cannot really ensure the positive impact of climate, and also we cannot ensure health. So climate change, how it is impacting health, this figure is showing that. It may be rising sea levels, more extreme weather, rising temperatures, increasing CO2 level, many factors involved. And if we see from air pollution, from changes in vector ecology, increasing allergens, water and food, extreme heat, and there's an example, say for example, air pollution is directly related with asthma, cardiovascular diseases. So it's more pollutant, more that kind of diseases. If it is severe weather, there's injuries, fatalities, mental health problem, there'll be more like that. If it is changes in the vector ecology, that malaria, dengue will be more prominent. Increasing allergens, respiratory allergens will be more. Water quality impacts, will be seeing more cholera. Water and food safety will be seeing malnutrition. So in every sectors, we see this kind of a system. This is a great work, and at a glance, we can see developed by our CDC. This is a great work, again, by CDC talked about the climate effects on health. If you take a look on this, is maybe physical health, mental health, community health. It's very clear that we are being affected by climate change. I found a very good article by Balbus and other researchers, and they come out the human health impacts of climate change. And one of their conclusions is the climate change can affect human health by changing the severity, duration, or frequency of health problems, and by creating unprecedented or unanticipated health problems or health threats in places or population where they have not previously occurred. And they come up with a very good table. You may not be able to see the tables clearly, but I have given the reference, so you can get it later on. The WHO, in a very at a glance, also clearly mentioned that's vulnerability factors like demographics factors, geographic factors, socio-political factor, socio-economic factors. That is connecting some exposure pathways like extreme weather events, heat, stress, air quality, water quality issues, vector distribution, our ecology, and then finally there's also being connected with health system capacity. Is maybe leadership, governance, health workforce, health information, essential medical products, service delivery, financing. So whenever you put all those things in a pot, how that is contributing to climate sensitive health risk. It may be heat-related illness, it may be respiratory, it may be genetics, more genetics diseases, it may be some mental or psychological disorders. So many things are coming into effect due to climate change. The World Health Organization, in fact, shared some very good key findings that climate change affects the social and environmental determinants of health, with clean air, safe drinking water, sufficient food, and secure shelters. They shared that between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress. The direct damage caused to health is estimated $2 to $4 billion. So the areas with weak health infrastructure, mostly in developing nations, will be the least able to cope up with this kind of a situation if they are not providing any assistance, because they cannot handle such kind of a situation without support from other countries. And reducing emissions of greenhouse gases through better transport, food, energy use choices can also result in improved health, particularly through reduced air pollution. That is what is happening. I found some other interesting findings in respect to climate change. WHO shared that to avoid catastrophic health impacts and prevent millions of climate change-related deaths, the world must limit temperature rise to 1.5 degrees Celsius. Even if we keep this level, we'll be having some problem, health situation. But global heating of even 1.5 degrees Celsius is not considered safe. However, every additional tenth of a degree of warming will take serious toll on people's lives and health. This is the findings from the Intergovernmental Panel on Climate Change. So what we are finding in here, if we accumulate all the deaths, 1/4, nearly 1/4 of the total global deaths is happening due to environment-related problem. Environmental risk factors such as air, water, soil pollution, chemical exposure, climate change, ultraviolet radiation, that contribute to more than 100 different diseases. That is the WHO statistics. This is a doctor, Dr. Philip Ladrigan. In his article, one of his articles, he's produced several good articles: pollution, climate change, global public health, and social justice. And he very correctly stated that for the 800,000 years before the present era, CO2 levels in the atmosphere are relatively stable and fluctuated between 200 to 300 parts per billion. However, in the past 2 centuries, and especially in the past 50 years, CO2 levels have risen dramatically. The current level is 413 ppm. A CO2 concentration not seen since dinosaurs walked on the earth. So the temperature is rising so bad that we are going back to the dinosaur era, where there is a huge number of global high temperature. And those are mainly being created by use of coal, oil, and gas. These are really shocking figures and statistics and findings. If I quote from MLK, one of his courses quote, "Of all the forms of inequality, injustice, and healthcare is the most shocking and inhuman." So that is what is happening. And WHO Director General recently very nicely stated that a healthy environment underpins a healthy population. No doubt about that. If countries do not take actions to make environments where people live and work healthy, millions will continue to become ill and die too young. So that is the projections of the health experts. What is our lessons today? Climate change happening faster than expected, and human health is being impacted by climate change. And what we found throughout the discussion, that injustice to grow further if we do not implement justice in drivers like climate change and health. Whenever we design, we plan, we formulate a law about climate change and also health, we must include justice as an important ingredient of that process. Let's formulate policy plan programs, keeping justice as an important component. And also another big factor is setting goals is one thing, implementing is another part, and ultimately taking each of us the responsibility to take that goals into an action is a different era. That is what we expect, that goals should be transmitted. It may be a global goals. Whenever it is transmitted into an individual responsibility, only then we can think that climate change may happen, but we can take care of it. Justice, injustice in climate change, injustice in health, but together we can take care of it. So that is kind of a purpose we want. I really appreciate This Climate Change Education Solution Summit is a very good platform to educate all of us, including our next generations, so that we can learn from each other, and together we can take care of climate change and public health in a better way. Thank you, everyone.